Welcome to RSNA 2022 at McCormick Place in Chicago, Illinois. This is the Imaging AI in Practice demonstration, and today we'll be talking about prostate cancer workup. My name is Madhavi Devuri, and I'm a radiology resident at UCSF.
My name is Kirti Megudia, and I am at Duke University.
For the purposes of this demo, the images may not line up perfectly because they're actually different patients. Our patient's name today is Frank, who is 65 years old and has a history of smoking.
All of you should recognize this as a PAC system. The demo will focus on this system, which you are used to working with. We are focusing on the Siemens Healthineers single carbon, which is cloud hosted for this demo. Let's set the stage for our scenario. Upon waking up one morning, Frank, age 65 years old, noticed that his right arm was heavy and hard to move. His wife called 911, and Frank was transported to the emergency department via ambulance for a suspected stroke. A stroke was verified and successfully addressed. Frank was then admitted.
During the hospital stay, Frank's care team noted a history of smoking and shortness of breath. They requested a chest radiograph. The radiograph is then performed and sent to the Siemens Healthineers single carbon PAC system for storage. The study is then sent to the AI Center AID MONAI orchestrator, which distributes the study to the appropriate AI algorithm. AID, developed by the UK government-funded AI Centre for Value-Based Healthcare, is a new operating system for the hospital that allows healthcare providers to deploy AI models safely, effectively, and efficiently. It provides a harmonized software and hardware layer that facilitates the deployment and use of any AI application. AID runs on NVIDIA infrastructure and embeds MONAI, an open source framework for developing and deploying AI applications.
In this case, our study is sent to the LUNAT Insight Chest X-ray 3 algorithm. Since Frank was in the ICU and the study was ordered as a STAT exam, which is reflected in the radiologist's work list and Siemens Healthineers Medicalis workflow orchestrator. Both the image and the report have been pulled up for dictation. The LUNAT chest X-ray algorithm analyzes the images and can detect atelectasis, calcification, cardiomegaly, consolidation, fibrosis, mediastinal widening, nodules, pleural effusion, pneumoperitoneum, and pneumothorax. Using heat maps and outlines, the LUNAT AI algorithm highlights suspicious areas in the chest radiograph by creating a new DICOM GSPS. Note the confidence score given for each of these categories.
The radiologist is then able to view the original chest radiograph directly in the Siemens single carbon viewer, but also in the Fovea Extreme AI cockpit viewer. This AI cockpit is launched into view, and there the radiologist can modify, accept, and reject the process results. The LUNAT Insight CXR3 functions as a companion to the radiologist's primary interpretation. Therefore, for this AI solution, the expected workflow is that the radiologist interprets the radiograph first and then uses the LUNAT AI results to confirm and perhaps augment the interpretation and verify that the AI did not find any additional suspicious concerns.
Let's take a look at the results of the LUNAT algorithm for this chest radiograph. Note that the Insight product identified a lung nodule with a 63% level of confidence from the AI algorithm. Results are sent back to the AID orchestrator, which sends them to the Siemens single carbon PACs. The radiologist completes their report per routine and Nuance PowerScribe. The chest X-ray report is quickly created from the template selected, in this case using the modality and body part. AI will drive the creation of an impression summary using recommendations for our patient's follow-up.
Now, before we get carried away with poor Frank's health troubles, we have to talk about follow-up recommendations. Plenty of literature has been written about the importance of closing the loop with follow-up recommendations made in radiology reports. This is where Within Health's RadNav comes into play. They apply natural language processing, a form of AI, to analyze the radiology reports and identify not only follow-up recommendations, but also specific details about them, such as timeline, type of procedure, and/or body part recommended for follow-up.
With a suspicious finding on the chest radiograph, Frank's clinical team requests a CT chest for further assessment. The order information is then sent to the GE Intelligent Protocoling Engine, which automatically recommends one or more radiology protocols based on the order information and the patient history. In this case, we can imagine that this screen is what a technologist sees. For the CT chest that was ordered, the protocol options are CT chest or CT chest low dose. In this case, the intelligent protocoling engine has protocoled this as a CT chest. By understanding the ordering indication and the patient, intelligent protocoling can determine the best exam type to answer the clinical question or flag the patient for radiologist review. This way, the radiologist weighs in when their expertise is required to make sure the protocol being done will answer the question being asked. Additionally, using the IAIP scheduled workflow assisted protocol option, GE Intelligent Protocoling also recommends one or more imaging protocols, which is displayed on the scanner. The technologist then can select the recommended protocols or confirm the auto-selected protocols. Note an option to manually update the protocol. This algorithm will remember your preferences for future cases. Now, this selected protocol is written back to the electronic medical record and other downstream systems like Siemens Healthineers Metacalis Workflow Orchestrator via the Qvera interface engine.
Quick aside here about Qvera. There are several different languages that are spoken by these products that I've mentioned, such as DICOM, HL7 version 2, and FHIR. That's where the Qvera interface engine shines. They act as translators between these standards so that all of these products can work together in this interoperability demonstration. The exam is performed, and as before, images are sent to the Siemens single carbon packs for storage and to AID Monia Orchestrator, which sends the exam to Cure.ai QCT algorithm. The QCT algorithm performs an analysis of CT chest images for lung nodules. The QCT lung algorithm detects pulmonary nodules and describes pertinent characteristics such as texture, margin, calcifications, as well as size and volume. The AI results that you see here are actually coded behind the scenes using a code system called the Radiology Lexicon, or RADLEX, developed by the RSNA. This allows for all of the systems involved in the radiology workflow to understand exactly what each piece of information is. The systems you see here support the IAIP AI results, DICOM structure reporting, and segmentation objects to be able to exchange the AI results with other systems.
The radiologist reviews the study on the PACS, but will pull up the interactive results in Phobia's Cockpit AI Viewer. Note that the images you see are DICOM secondary capture images, which are static. In other words, you can see AI results, but you cannot alter any presented findings. To clarify, SC is static. Once the image is labeled, it cannot be changed. Think about this as screenshot, meaning annotations may not be removed and unnecessary labels persist. So clinicians or radiologists who only see the SC in the future without also looking at the final report may be misled by a preliminary, potentially inaccurate interpretation. On the other hand, SR is dynamic. Annotations to the DICOM can be modified or deleted as the radiologist crafts their final report. This way, providers without access to the report may still receive a final, complete assessment by viewing the SR.
So in our case here in the CT chest, the key index lung nodules are sent to the report. The number of nodules reported was pre-configured by the radiology report to be 5. The radiologist then completes her report per routine and nuanced power scribe. After recognizing the key index nodules, which are sent to the report, the radiologist also notes that there are sclerotic bone lesions in the thoracic vertebra. The nodules are recorded, as well as a sclerotic bone lesion, and the radiologist recommends further workup for these sclerotic lesions, which can be seen in a number of metastatic diseases. Given the differential diagnosis of sclerotic bone lesions, the clinical team orders a PSA level, which ends up being elevated. They then order a prostate MRI, which is requested to assess the prostate for lesions prior to a biopsy.
Meanwhile, within Health RadNav, notice the CT report satisfied the previously mentioned recommendation and mark that follow-up recommendation as complete without having a care navigator in the process. Yay for closing the loop.
Now back to our MRI prostate. So the MRI is performed, and as before, images are sent to the Siemens single carbon packs for storage, and then to the AID Monia Orchestrator, which sends the exam to Siemens Healthineers AI Rad Companion. Siemens Healthineers AI Rad Companion performs analysis of MRI images and does prostate segmentation and volume estimation, computation of prostate volume and PSA density, and PIRADS grading. The radiologist is able to view all the AI model's findings in Fovea's AI cockpit viewer. This includes prostate gland results and lesion-specific information. Note that the PSA values that were seen in the EMR by the clinical team were obtained by a FHIR request initiated by Qvera and then integrated with DICOM data, specifically volume measurement, allowing for calculation of PSA density, which requires the PSA level. The radiologist is able to now edit and exclude any of these data points before they are transmitted to the reporting system to be pre-populated in the report. In the past, we used to have to look up the PSA levels separately. And in this particular case, the PSA level is automatically integrated into the AI algorithm to be combined with the prostate gland volume to calculate PSA density, which increases efficiency. The radiologist completes the report per routine in PowerScribe and sends it off to the clinical team to let them know that they need to biopsy this particular lesion. This is where we conclude our clinical scenario.
AI Center Aid by Monai, as well as the Fovea AI Cockpit, also supports the IHE Standardized Operational Log of Events SOL profile to be able to measure the effect of AI on workflow. IHE's SOL profile allows for the standardized event logging, adds metadata to all of our messages so that we can finally track the impact of the steps in our workflow, or nowadays, the impact of AI on our workflow. Products like Siemens Insight can take all the SOL codes that have been flying between all your workflow components and display them in an easily understood dashboard. You can track conventional items like turnaround times, but also answer more complex questions, like how often do my radiologists disagree with an AI assessment? Or how long is an AI model taking to present a result? Go track crazy and learn the insights that will take you to the next level of efficiency. Thank you for coming to the Imaging AI in Practice demonstration.